Assalamu alaikum. My name is Dr. Hafiz Iftakhar Hussain. I am working as assistant professor in the Department of Pathology, Cholistan University of Veterinary and Animal Sciences, Bahawalpur. The topic of discussion is stress and health. Stress is the spice of life. Who would enjoy a life of no rules, no hits, no errors? It means if there is stress, there is more enjoyment of life, but more stress leads towards the different development of disease conditions and the behavior changes. What we should know, what is stress? Stress is the process by which we perceive and respond to certain events that we see as threatening or challenging. There is transaction model, mean the stress resides neither in the person alone nor in the situation alone, but rather in the transaction between the two. There are different types of stressor. What is stressor? Any event or circumstance that cause stress is called stressor. Stressor as such not cause any stress, but our perception of that event, the meaning we attach to it, and the way we react to it leads to the symptoms of disease or stress conditions. There are different types of stressors like biological stressor, for example, person on a bed for a long time suffering from different diseases, environmental stressors like floods and storms, etc., life-changing stressor like separation of parents, cognitive stressors in which the person is unable to cope with different conditions because of his or her mental level. The types of stress. There are different types of stress. Acute stress. Acute stress is the reaction to an immediate threat, commonly known as the fight or flight response. There is chronic stress, frequently stressful situations that are not short-lived on the urge to act must be suppressed. This remain for a long time leads toward the chronic development of stress. There is use stress. It is the good kind of stress. Pleasing will result at the end of the stressful situation like planning for a marriage or uh, some party. Distress. It is the displeasing kind of stress. It is bad kind of stress. When there is stress, the body shows response to that stress. The sympathetic nervous system releases the stress hormones epinephrine and norepinephrine from nerve endings in the inner part of the adrenal glands, while the pituitary hormones in the bloodstream stimulates the outer part of the adrenal gland to release the stress hormone cortisol. These stress hormones cope with the stress and make the person to come out of that condition. Stress and illness are directly proportional. These psychosomatic diseases are defined as the physical ailments with a genuine organic disease that are caused in part by the psychological factor, especially the emotional distresses. For example, hypertension, ulcer, asthma, headache. And then emotional problems like anger, panic, fatigue, sleep disorder, depression, attempts for suicide or suicide. There is twofold effects of stress. The persistent stressor and the negative emotions leads toward the release of stress hormone. These stress hormones cause different diseases like heart diseases, immune suppression, and the autonomic nervous system effects like headache and the hypertension. While at the other end, they cause unhealthy behavior like smoking, drinking, poor nutrition, and sleep disorder. Stress and immunity are directly proportional to each other. If there is more stress, the immunity will decrease. The stress weakens the immune system by diverting the energy required for its functioning to deal with the stress. So, cortisol hormone released during the stressful emotions affect the immune system greatly by preventing the production of cytokines, and that will leads towards the more development of inflammation of cancer and the cancer. During chronic stress, cortisol is overproduced, causing fewer receptors to be produced on immune cells so that the inflammation cannot be ended. Stress and chronic heart diseases are there. Chronic stress causes the increase in the level of lipid, the blood to become thicker, and increasing the likelihood of an artery clogging blood clot that will lead to cardiac thrombosis and heart attack. Stress and hypertension are very important. The essential hypertension is a condition in which there is chronic high blood pressure, usually with no known biological cause. An individual that shows